Hello and welcome to the latest in our series of Health Tech World Roundtable discussions. And today we're focusing on digital defence, principally how to protect health data in the age of cyber threats. We've got a really distinguished panel with us today, a group of experts who I'm delighted to say have agreed to share their experience and their insight with us. And I'm going to ask those panelists to introduce themselves just before we get into the main body of the discussion. So if I could kick off with you, Adam, if you'd like to say a few words about yourself, your organisation and your areas of particular interest, that would be really helpful. You're on mute, Adam. It's usually me that does that, so I'm glad you've got that out of the way.
Apologize there. Certainly, Adam Moore. I'm head of cloud here at Elekta. We provide oncology-specific radiation devices, as well as EHR and oncology-specific software. In our cloud, we're providing sort of EHR, electronic health records, to about 650 institutions in our cloud in 41 countries. My background is I come from building data centers and cloud systems and managed services. So came into the health tech industry or medtech industry from the outside, really kind of enjoying the maturity journey that we're undergoing, because certainly there's a huge maturity journey and opportunity for us right now.
Fantastic, thanks, Adam. Can I come to you next, Afshin?
Sure. Hello, everyone. Afshin Attari. I'm the Director of Public Sector here at Exponential-e. I'm part of our leadership team here, and I'm responsible for our government business. But we do have a significant focus around the health market. We are a UK-centric, UK-focused, mid-sized managed service provider. Just to give you a feel of what we do, we connect 16% of the health and social care network in England. So if you go into any hospital or any GP in Northwest, Southwest, or Southeast London, you'll be connected to the Exponential-e HSCN network. We provide circa 20% of the platforms for pathology in the UK, working with NPIC, with a private cloud partner there, and we provide managed services in the space. I've been working with the public sector in excess of 20 years, and a final note is at the time of COVID, our organization was classified as a critical national infrastructure supporting the NHS, and we stepped up and we delivered multiple solutions for remote connectivity, telephony systems in the cloud, et cetera, et cetera. So we are a service provider focused on public sector and critical national infrastructure.
Great, thanks very much, Afshin. And Andy?
Yeah, I'm Andy Heins. I'm the Vice President and Chief Information Security Officer for Lifepoint Health. Lifepoint Health is a healthcare system that is roughly in 32 states. We have 60 community acute care hospitals, 48 rehabilitation hospitals, and roughly 25 and growing behavioral health hospitals in the United States. So I've been with the company for roughly 15 years as the CISO and various other positions. And so obviously cybersecurity is front and center for us.
Great, thanks very much, Andy. What I'd really like to do now is go around the panel and ask each of the panelists what they regard as the big issues and the big threats when it comes to protecting health data. So just to get the discussion going, we'll go around the panel. And again, if I could start with you, Adam, please.
Sure. I think without invoking the word AI, because some of your audience will roll their eyes when I mention the word AI, I'm sure. I think there's an evolving threat landscape out there that's becoming continuous, more sophisticated, and the maturity journey that we're going through to keep up against the attackers is a higher threshold than we're used to. Our adversaries or the threat actors, they only have to win once. We have to win every time, and that's an evolving threat and a difficult threat, especially in healthcare, where traditionally the investment in security has been minimal, and we've definitely got to kind of keep up against the threat adversaries.
Thanks, Adam. Afshin, the big issues as you see them?
I would classify them as opportunities and then focus on the issues. If you look at what's happening in the UK, there's a great emphasis on the back of the healthcare 10-year plan around enabling health in the community, going from analog to digital, and actually moving towards prevention rather than cure. But there is a big emphasis around digital health. And that is the great opportunity which it brings, with demographics changing, the pressure on funding, and the need to use technology to deliver better health outcomes. The challenge related to that is that if you look at the healthcare system in the UK, it's quite dispersed. There are a lot of legacy applications and systems in situ. So the threat vector will increase immensely, notably as we are seeing a lot of applications moving from off-premise into cloud as well. So the challenge is one which is centered around discovery and understanding what you have in situ, what those applications are, what those systems are, and some of them are quite critical and not easily replaceable, and then protecting those coming to situ. So the focus on digital is growing. It has great opportunities for productivity and outcomes, but it does carry a burden. And what I would say is, certainly in the UK, there has been a great focus on protecting wealth. I think now we need to put a lot of focus on protecting health as we move into the digital arena and the digital world.
Thanks very much, Afshin. Andy, the big issues?
Yeah, I think healthcare here in the States is, it's complicated, right? You take, these are not businesses that just started up and, they're born in the cloud, right? So the amount of vast technologies that exist in all of healthcare across, a health system, are not necessarily technologies that you just replace overnight. You're not buying a new CT scanner every year, and so you have a lot of legacy technologies, large capital purchases, and then you have the vast amount of third parties now. And so that, as new systems come in or be replaced through new SaaS providers and third parties, and we have the big hosting providers of even those systems that are being hosted. You have a very complex ecosystem from a technology platform standpoint. And as you start to, analyze your risk about uptime and resiliency, you have a lot of reliance on your third parties. And so, and when you think about the traditional, hospital maybe 20, 30 years ago, where everything was in the box, there was no reliance on third parties. You didn't have interfaces that needed to communicate, where, from a point of care standpoint, if you went to one hospital and you went to another hospital, where that data would traverse, where you could get your lab information and so forth. So very different, from say the financial sector that's been, somewhat digital, integrated and protected, without the new use of new technologies being always coming in, like Adam said, around AI. So if you're not in the business now of evaluating how you're going to evaluate your data and be competitive, and try to leverage some of the newer tools, you're going to be left behind. And so from a security standpoint, it's really important to be able to understand and work with the business and understand what those new challenges or new opportunities are, and make sure we're doing them the securest way possible to be able to not be a blocker, but an enabler.
Thanks very much, Andy. I'm just going to sort of open the discussion now, and hopefully panelists will indicate when they'd like to come in. When we're talking about data, particularly on Health Tech World, it's usually been in the context of big leaps and developments that promise progression for the future. We actually haven't focused that much on the security aspects. I think a lot of people watching this would be really keen to understand why healthcare may be a target for some of these cyber threats, and maybe some examples of common threats and how the industry is responding to them. So I'm hoping one of our panelists will get that going.
Yeah, I can jump in on that. I mean, I think specifically, it's you think about healthcare emergency settings, people need care. They're going to a point of care location. obviously to seek out assistance from a health standpoint. And so you think about a bad actor, if you think about how to get money or ways to disrupt that from a critical infrastructure standpoint and hold someone in, ransom or accountable to, basically put in a lot of pressure to be able to continue to allow to have services open, they know that's a pain point, right? And pressure would be added. And so obviously there's mechanisms and ways where bad actors continue to be clever and think of new opportunities to be able to seek and disrupt those services. And so in our area, we're always being curious and thinking of new ways to prevent the whack-a-mole kind of a scenario and be hopefully more proactive than detective on everything. So we're kind of getting ahead. Email obviously is a big threat vector. But third parties coming down to that. If I can compromise a third party that I have a huge amount of leverage or leverage that I use, to run my business, they know that's a pain point as well. So third party, I kind of mentioned that prior to, the amount of vendors we partner with to support our business is a large part of that. So I think that is one of the bigger complexities on how just an external, and then, I think with AI and some of the newer challenges around just recruiting and evaluating who your workforce is and making sure you can stay abreast of scams. There's financial scams, payments, as far as paying your vendors and so forth. There's a ton of things around impersonation. And so I think really from a security, trying to stay ahead is really trying to understand and evaluate what the bad actors are continuing to do. The schemes that they've, continue to see, where a bad actor will, trick patients into paying a bill, go into leverage in a PayPal, and even the bad actor taking other stolen credit cards and actually going in and paying their bills on behalf of that patient that entered their billing information to pay their bill, which they thought was, being hosted by another third party. So thinking through the scams, like more and more threat actors are becoming more savvy to gain more time, where that person might not even know that they've been a victim of identity theft or even their patient information being stolen. So it amazes me the creativity and unfortunate and bad actors and threat actors put into their craft. But for us in the cybersecurity field, we have to continue to sharpen our swords to be able to defend against it.
If I can bring it, thank you. Not accepting what Andy said, I think the dynamics in the UK is slightly different because we have a national health service, and what we're seeing predominantly here is the financial threat of ransomware has always been there, but what we're seeing is a geopolitical threat emerging, and what we're saying is the threat of disrupting critical national infrastructure, of which healthcare could be one, to drive motivational political outcomes and distracting resources in the country. So if you think about what could happen is the NHS, which has high visibility around government, around delivering better healthcare, if it's impacted through ransom, cyber, or threats, bringing systems down, that could have a great political impact. But secondly, it'll put a lot of strain on government resources in restoring that service to where it should be. And I think bad actors, political bad actors, there is a threat that they will utilize that to disrupt national infrastructure, to distract them or pull them away from the international arena. That's the biggest threat that we're seeing currently in the UK, with the geopolitical landscape sort of somewhat tense with what's happening in the Far East, what's happening in the Middle East, what's happening with Ukraine. That's what we're seeing over and again, notwithstanding the financial ransom aspects of actually want to extract value. But I think it's disruption that we're seeing is the biggest critical factor here.
That's a really interesting dimension. Adam, I can see that you'd like to come in.
Yeah, I think you both make good points. And, definitely, we see the nation states sort of actors out there looking to disrupt sort of critical infrastructure. And we see the criminal actors. And I think healthcare has become more and more of a target. One, as Afshin kind of pointed out, for the disruption element, the national headlines, etc., but also for the criminal threat actors to disrupt and exert influence, quick ransomware, simply because the stakes are higher. And I'm not discrediting kind of banking or technology firm, but the disruption to the infrastructure has real world implications on patient care. So more health systems are more likely to either pay the ransomware or drive to faster recovery. And what we're seeing, we do see that kind of around the industry, because being offline for weeks at a time disrupts patient care to the point where patients are negatively impacted, mortality rates are negatively impacted, and we're seeing more and more sophisticated attacks on health. I personally and my team receive kind of briefings on the sophistication of attackers, and what people believe as the threat actors are guys in hoodies that are sponsored by nation states, or these guys are sophisticated operations. I get the briefings on the dark web. They have gold, silver, platinum support fees where you can go on an online chat and talk and say, well, my ransomware attack hasn't worked, and get sometimes better support than some of the organizations that we deal with on a daily basis. So we see that sophisticated attack come up, and the more sophisticated attacks at arm's length, we see that exerted more and more in the healthcare systems, because they're easier to disrupt, because traditionally there's been minimal investment in security, and it's a longer time to build our security profiles, because we have to go through medical device, FDA clearance. We have to get our devices clearance. We have to kind of encapsulate a medical device. So traditionally it's been harder to update those devices. So what we see is a plethora of supply chain attacks coming forward. There's different vendors, different ecosystems, and more complicated ecosystem vendors and supply chain attacks are taking advantage of that fragmented ecosystem.
Thanks, Adam. I assume that people come into this in quite a big way. It might only be my experience, but occasionally when you're talking to people about cybersecurity in your workforce, you get blank looks. How important is it, and how difficult is it to get an entire workforce to understand how critical cybersecurity is and all the measures that they should be taking, along with the work that you do at a more senior level?
Yeah, I would say that part of our strategy and culture around information security is, about educating folks at how to protect themselves at home and how that bleeds over into the workforce, right? And so when we think about digital privacy, and I think if I surveyed our workforce and said, how many people have been impacted by a credit card being stolen of theirs, being or identity theft, or knowing somebody that identity theft has impacted them, they understand. Obviously, in our field, where time is of the essence, and you're trying to remove friction from nursing physicians and logging in the systems and having multiple logins and trying to coach people on password hygiene, some of just the simple things. I think that the conversation has got easier around security because they know it's important. Obviously, we're heavily regulated and we have rules and reasons, and so I think it's important for some of the newer generations to explain, like, hey, why do we do these things? We're not just coming up to be, the no police or create rules that are become obstacles, but also certainly understanding the challenges. The more complex and complicated we make it, the higher the service desk calls we have, all the different, the back end of these things. So definitely having a balanced approach, but education is one of our things we have a lot of fun with. We try to make security fun, as weird as that might sound, and comical. And so we have sessions of awareness videos and things that are, that are unique. So we do have a lot of workforce that are remote as well. So I think that is a core tendency of our program around awareness and trying to educate. I've never met someone, when I'm talking about cybersecurity, if they're complaining about, multi-factor authentication or something along those lines, like, well, do you do this at your bank? Well, yeah. Why would we not do this for, something where we're trying to protect our patients? And it's like, oh yeah, you're absolutely right. So I think some of it's just putting it in context and saying, we're making these investments. We don't want to be left behind. because we do see a plethora of people coming from different areas of the United States, or maybe they did work at a healthcare company that didn't take it as seriously, and we might have more complexity or more investments we made, and so we kind of try to educate them and bring them along on what hopefully what good might look like.
Afshin, Adam, any thoughts on that? Winning hearts and minds and education?
I'll cover that, but if I could maybe just cover a number of other things, if I could just unpeel this onion in a way. So I get asked this question frequently when we engage with the health service and the execs around what do we do. We take a number of steps, and we recommend a number of steps. The steps that we recommend is really starting with discovery. I think the first point is discovering the environment, discovering the applications, discovering the landscape, because there's a whole legacy of shadow IT and other applications and systems which have been there for years, which is not very visible. The second is assessing the relevance of those applications and systems with regard to the direction of travel. Do you need those applications? Are they relevant? Can they be protected? Are they relevant to the continuity of operations? I think protecting data in transit is another one that we talk about. We are a networking company as well, so secure services around encryption of data in transit to make sure that it's not attacked. And then securing borders. So if you look at the healthcare system, it's a very mobile workforce, mobile applications. So talking about endpoint detection and creating a secure boundary to prevent access is another key factor. The point that you mentioned, Alistair, is we call it empowering the human firewall. How do we ensure that our staff and the external staff are trained, empowered, understand the necessity of being vigilant, being aware around cyber threats? One click, one access, one visit to a certain site could actually open up. So education and training is quite crucial in supporting that journey. Maintaining and monitoring visibility. So is the threat there? And this is where the AI aspects can come in around using SIEM services or using CSOC services and AI-powered technology to monitor unwarranted or unusual traffic to support that detection. Testing relentlessly, not being complacent, ensuring that you test and you continually test to make sure that there are no breaches, and then building a resilient framework, a framework which is repeatable, which encompasses all of these elements is quite crucial. And this requires some rigor, it requires some expertise, and it requires tenacity, of which some of aspects are system-based, some are investment-based, but coming back to your original point, some are cultural-based and human-based, and that's where the investment in training comes into play. So as Andy mentioned, we try to make security training fun. There are videos which sort of are like akin to Netflix-type videos, and what people do is we call it the inside actor, and then the 6-7 minute videos, and it talks about live scenarios, which puts a live example in a fun environment, which helps people to understand that. So it's trying to make a dull subject, which is high impactful, interesting, and getting the cultural aspects of alignment and understanding the vulnerability widely communicated within the organization.
That's really helpful, Afshin. Thank you. Can I move on to talk about, not just AI, which you mentioned, Afshin, but emerging technology. What's changing, and how are some of these emerging technologies, AI, machine learning, automation more widely, changing the nature of the threats that you experience or that you anticipate?
Yeah, I think obviously from a clinical standpoint, AI is going to be key in the future. I think providing information to caregivers in a way that's faster accurate, but then also giving them, like, I would say, like, making a decision for them where it's, AI generated, and AI is going to make a decision. I don't think that's going to be for quite some time. Humans are still going to be needed to make those calls, and so, but I think having that as a data resource with references and really good consistency around potential outcomes or potential diagnoses. So I think that's still, I would call it a work in progress. But obviously, think about notes and interactions with patients and being able to leverage the dictation services and leveraging AI for, really good recording of notes and being able to, refer back that into a record. I think there's going to be a huge operational technology and good outcomes from a patient standpoint. As far as AI as a threat, obviously the same tools that we're using on the detection response and being able to really provide proactive monitoring and from a detection standpoint, it's fantastic. And it's allowing us to be faster and react much quicker to the telemetry and the signal that we get. But obviously bad actors, are leveraging the same technologies. Their tradecraft on their communications have gotten better. I think we're seeing far less bad grammar emails that are phishing. So they're definitely taking advantage of it and definitely leveraging it to their capacity. So I think, it's a bit of an arms race to be able to leverage the technologies at hand for the good, but also knowing that the same technologies are going to be used with threat actors. There's Ghost GPT, which is a threat actor AI tool that's being used for exploits and vulnerability analysis that can be used by someone that's not technical. So I think the challenge is, leveraging what we have for the good, and then at the same time knowing that bad actors are going to use the same technologies to try to, really increase their capability and their success rate.
Adam, we were just talking, you probably picked up on that, about emerging technology. When we started the discussion, you mentioned AI, but any form of new technology and the way in which it's changing the nature of threats and how you respond to them.
Absolutely. I think, AI has been around in various forms for a while. I always kind of joke with my team is, it's the Scooby-Doo mask. You lift up AI and it's machine learning, or if this, then that statements. But what we are seeing is these automated tools, is threat actors out there are using them in more sophisticated ways to find weaknesses, and they're using it in more sophisticated ways rather than direct attack, but to social engineer attacks, to build out supply chain attacks, to build out sophisticated attack and waiting attacks, and surveillance attacks. I was at an event recently in Las Vegas where we got kind of some briefings, and there was one thing about AI that horrified me, which is compromise as a service, where some of these AI actors are essentially for ransomware. They're finding whoever is responsible for paying a ransomware and putting out automated hits at hand to be able to take photos of your kids at school to exert send you the picture of your kids and exert sort of pressure to pay the ransomware. And I think most of us, if they got a picture of our kid, we'd be like, that's a very scary prospect. And we see that they're coming up with more and more sophisticated ways to build out new threats and leverage new threats. On the flip side, in the security front, we're also able to sort of leverage sort of the AI, the machine learning, to focus more on productivity, to reduce sort of threats, to reduce noise. And, instead of having 1,700 alerts where we sift through and there are false positives or not real sort of attacks, but really sort of focus on, well, these are the real problem statements that I need a human intervention to go and look at and investigate. And that allows us to decrease kind of mean time to response, mean time to action, mean time to kind of solving and plugging the hole of the cyber attack. So, I think it's always been a game of, Tom and Jerry or cat and mouse in cybersecurity. The security are always kind of trying to stay ahead of the attackers, and we're just at a new level of the cat and mouse game. But it's definitely an interesting evolution, because we're seeing new threats and new vectors kind of being unlocked through the power of AI. I think that was one of the industry myths that ChatGPT used to be able to search the open internet, but attackers, were able to find 0 days and type into ChatGPT and say, as an attacker, tell me all the vulnerabilities that this bank has, and ChatGPT kind of let's hold our horses with this technology a little bit.
Any thoughts, Afshin?
The way I see this is if I've touched upon the threats of cyber and the protective measures that one would take. But if you look at the benefit side, where we've been actively involved in is, if I give one example, is around digital pathology. So the question is, how can you translate data into information to deliver better patient health outcomes? And one of the uniqueness that the UK has is around the NHS is they're not competing entities. They're a shared environment, which is a national service. And what we've seen is pooling of pathology or digital imaging on a platform, which allows that information to be accessed. And one example could be, with the aging population of clinicians in the UK, you may have rural parts of the country where they may not have access to specialist consultants. So if that information is in a data secure environment which is shared, you could have a clinician, a pathologist sitting in Birmingham accessing a image in Worcester for a patient which requires to be seen. So there's great opportunity of sharing information across the country, across different entities, to gain a better view around patient outcome and healthcare. If you take that a step further, the question is, how can AI help? Now, AI, we need to shy away from hallucination AI, because we don't want AI to sort of make recommendations which are unwarranted and unvalid. But what AI can do is, by looking at those data sets which sits in platforms, is to look at trends, look for anomalies, and look for instances where something does not look right, and then pass that information to a pathologist to review. And that takes the burden away. So effectively what we're doing is we're focusing experts in narrow fields of areas which require attention, rather than having to wade through a whole raft of data sets, which, even if they're not digitized through glass images, etc., which isn't very useful or very productive. And then if you take that a step further, what we've seen is the innovation around AI is coming from multiple organizations. There isn't one organization which has sort of all of the capability around all of the fields of AI. So the question is, do you transfer data to each individual AI entity for analysis, or do you pull all of the AI capability from different entities in one data lake, which is secure, providing a access for the health service to be able to query different types of outcomes? So digital technology, digital platforms, the use of the new ways of working can really help us. That's the great opportunity. The threat that people are very worried about is, how do you protect that data, which we've talked about. It's around ensuring the protection mechanism in situ. So, and in the UK, if you look at the aging population and the funding challenges, we cannot continue the way that we are in serving the population, because you can't keep increasing the NHS funding. There needs to be a rethink, and that's why the digital to analog to digital, which is part of the 10-year plan, is one of the areas that government is really focusing on. So I think that's where the opportunity is, but it does require expertise and input to protect the vulnerabilities which the health service needs support on, because it's not their core capability.
Thanks, Afshin. We've covered a lot of ground. Before we sort of start to bring the discussion to a conclusion, is there anything that we haven't covered with reference to that sort of core subject of protecting health data that anybody would like to raise, or any issues that you'd like to address? In that case, what I'd really like is going round the panelists again, just for some final thoughts. I think everybody understands that data is going to offer marvelous developments for healthcare, and particularly personalised healthcare. Protecting that data is fundamental. Final thoughts, maybe directed at policymakers, or just your thoughts passed on to other organisations or other professionals about the one or two things that you think are absolutely essential and crucial as we look forward, and as we consider data being even more important to the health industry, whether it's in the US or the UK. So maybe I could start with you, Adam. Some final thoughts that you want to leave with those watching.
I think at Elekta, we've really embraced, a new philosophy, going from, the old adage of security or security by design, that, I think everyone should envelop that security is not a destination or a one and done. Security is a journey, and a continuous one at that. And we need to continuously look, evolve, and be ready. It's, the old adage, it's not a case of if, then when. So, to be on that continuous journey, continuous vigilance, and continuous evolution. I think that's critically important for the entire healthcare industry.
Fantastic. Thanks, Adam. Andy?
Yeah, I mean, I can't agree with you more. I mean, I think it's challenging. I know that the U.S. side, with HIPAA, there's been a lot of revisions, and I think for the most part, it's pretty bipartisan. Like, we know that from 1996, things have changed from a HIPAA security standpoint, right? And so I think it's a great foundation. I think there's a lot of opportunity. I think folks probably shouldn't be waiting for to be told what to do. They should be pretty, I guess, leaning in forward if they haven't figured it out yet, and there's investments they need to be making or haven't already made. They probably had incidents that's forcing them to lean in and become more secure with modern technologies and processes, and really making decisions on how to leverage people in ways from a security standpoint. So we're certainly making those investments and continuing to the evolution, not being told what to do, but having to make the wisest decisions that we can make with the funds that we have, and to be able to protect our patients in that population. So it's certainly an evolution. There's not a silver bullet necessarily. So it's defense in layers, and making and educating folks on those layers, just that way you don't create friction along the way. So.
Thanks, Andy. And Afshin, you get the last word.
As I said, I've been dealing with the public sector in excess of 20 years. And what I've seen is strategic intent is great, policy is great. The challenge always results into plans and actions which deliver tangible outcomes. And if we look at where the challenge and the opportunity is around the health sector in the UK, is I think everyone recognizes there is a need for change. But also what we see in the industry is that in order to make that change, there is a skills gap, a skills knowledge around capability in this space. The capability around cyber security is highly prized in the market. And so if we expect the NHS to embrace this journey alone and become experts and embrace this challenge alone, I think it is a tall order, and we don't want that strategic intent just to be a strategic intent. We all have a vested interest for this to work. So I think with innovation and change, there needs to be innovative ways of engagement with the market, innovative engagement with partners. And what we have to do is we need to embrace this call to action and work with the NHS and the health service in the UK, specifically where we're focused, to bring that capability that we have to bear. Because I think that will support us helping the nation. And actually, we are commercial organizations, but as part of our commercial reach, we have a sense of duty. And our sense of duty is supporting the nation. And how can we make that happen? So I think it's not just a puristic change model. I think it requires a cultural way of thinking of embracing and working in a collaborative manner, which will deliver tangible outcomes. That will be my view.
Thanks, Afshin. That's a really positive note on which to close this discussion. And I think those final thoughts really represent a bit of a manifesto for cybersecurity in the future.
Sure.
On behalf of Health Tech World, I'd just like to thank each of our panelists for being willing to share their experience and their insight. It's been a great discussion. For those watching, please share this as widely as possible. It really does deserve to be seen by the biggest possible audience. Thanks once again to our panelists, and we look forward to maybe picking up some of the strands of this discussion in future conversations under the Health Tech World banner. Thank you.
You bet.
Thank you. Bye.